everybody, it's me, MissFootFixer. Hope you are well. We are doing an injection on a toe because it's a really annoying ingrown toenail there. So we're gonna just do a small needle, 1, 2, 3, done. That's there. It's not that big actually. It's very ingrown. This is going on. Cut in here. So the nail is very wide here. We've got lots of debris. See the nail there. Pressure. Bit of scar tissue, perhaps. Let's cut it. Address this. It's a minimal kind of abrasion there, but hopefully the ultimate pain is there. If it isn't, sometimes you can have nail inside, but I doubt it, to be honest. That can cause a problem. Just putting a nice sterilized dressing on. So long term, we've discussed kind of doing a partial nail erosion, which is deeper, with the pheno or laser. Then we talked about the soft tissue resection at the tip, which in deviate X-ray needs to confirm is the bones elongated. Sometimes Jason can just tell off the bat. Not these tape, just really sticky. Like that, okay?